Hi, I'm Dr. Jeffrey Antimarino. Welcome to Bellissimo Live. In this episode, we're going to introduce a brand new provider for us, Angie Johnston.
Hi, everybody.
Angie is a nurse practitioner that just recently joined us a few weeks ago, and she's going to be doing injectables and lasers and also seeing and treating patients. Also, you may recognize Beth, and Beth really runs all of our Spark website and all of our social media with Ella. So she's planned to be here tonight so that we can introduce our newest device, the PlaDuo. This is a device that uses nitrogen gas. It's a little different than the CO2 laser, which we've done in the past. This one also is a device that treats the dermis of the skin. So that's where the elastin and collagen lives, and that's as we get older, that's what thins and shows signs of aging. So the CO2 laser, as we talked about before, penetrates from the outside, treats the external skin, and then penetrates down into the dermis. So it can treat fine lines, sun damage, precancerous lesions, and also kind of treat some fine lines and give a little bit of tightening to the skin. The PlaDuo, on the other hand, actually penetrates through the outer surface into the dermis. Its target, like the CO2 laser, is water. But instead of tackling the collagen, it really tackles the elastin bundles in the skin. So with this device, you can actually get some plumping and this kind of glow to the skin. So the skin actually feels a little bit thicker and firmer. It doesn't do anything to resurface, but it also has a antibacterial component. So we can actually use this to treat active acne. So this is good for any teenagers or adults with onset acne. And we've had some pretty good success with that as well. So this device is brand new to us. We've been using it now for the last couple of months, and we've seen some great results. The other device that we've talked about in the past is the Virtue, which is a combination of microneedling and radio frequency. That device penetrates a little bit deeper than this one into the dermis and causes a little bit of heat to the collagen bundles. So what we've been able to do is combine these three devices. We can either use them in combination depending upon what the goals are, or we can use them separately. So the nice thing about it now is we really have three different devices that we can really treat all types of skin types. So this one can be used for all types of skin coloration, same with the CO2 and the Virtue. And we can control the heat, we can control your downtime. But for whatever your goals are, we now have the third kind of missing piece of the puzzle. So now the puzzle's complete, and we can treat all types of skin types and all kinds of skin problems using these devices. So tonight, we're gonna demonstrate that, and we're gonna get this thing fired up for us. It makes a slight popping noise, and all you feel is a little bit of heat. Beth has no numbing cream on. This is just, we have her cleanser face with a gentle cleanser, and she's ready to go.
Hey, Beth, are you ready?
Mm-hmm.
All right.
The first one's kind of a shock, but it doesn't hurt, does it?
No, no pain at all. It's just a little bit of heat. So how many treatments does a patient need? I know it may depend on their aesthetic goals, but on average?
Usually takes 3 treatments. So similar to the other 2 devices that I talked about, the Virtue and the CO2 laser, we use them about a month apart and for 3 different treatments. Sometimes with the active acne, sometimes it might take 4 or 5 treatments. And then there's always some maintenance, usually once or twice a year afterwards. This device can also be used down into the neck, the décolleté, back of the hands. So we can use it in all different types of areas, just like the other 2 devices.
So you mentioned that this one targets elastin in the skin?
Correct.
While the other ones target kind of collagen?
Right. So the collagen, when you target that, it actually firms up the skin, so it tightens it a little bit. The elastin actually causes a plumping of the skin. So a lot of the patients that have it, even the next day, the 24 to 48 hours afterwards, that they actually say that their skin feels much more plump. They have this glow to the skin. It looks much more rejuvenated.
Should I wait to put makeup on? Should I wait to cleanse my skin tonight?
So actually you can start using makeup tomorrow, and you can see a gentle cleanser on your skin tomorrow.
As we were chatting ahead of this, you mentioned that it kind of targets the water that's already in your skin. Should someone who's preparing for this treatment drink a lot of water that day?
Yeah, so it's definitely something that you want to keep your skin hydrated, and it's okay if you're a little bit dehydrated, but you really do, the better results are going to be with hydration of your skin.
Is there another thing you're noticing, Beth?
Yes, like the smell of hair burning? Is that what you mean?
Yeah, so it does use, so it has like a tiny flame to it. So the very superficial, like baby hairs or what we call vellus hairs, they will actually get singed. And so your skin actually feels a lot smoother just because the vellus hair is gone. So it's almost like getting some type of like dermaplaning done.
Mm-hmm. So you said it kind of plumps the skin.
Mm-hmm.
That would be helpful as we age, like for the décolleté, for on the backs of the hands.
Right. So, and that's why it's kind of nice, especially in the lower part of the neck when it starts to get that little bit of crepey skin. Then this is really be helpful to it. I like the CO2 laser in the neck and décolleté area too, because there's also a lot of sun damage in that area. So that also helps the skin start to look a little bit crepey and weathered. So the combination of doing this first and then going with the CO2 laser afterwards is really the suggestion.
I know with the microneedling device, it's not recommended that you get injectables like right before, I think. Is that correct?
Yeah, so we try to space them out so we're not treating right on top of injectables. So with this, as long as you're going to wait a couple of weeks, you should be just fine with it.
I'm just going to tell you.
Mm-hmm.
There we go. Just go on the contour.
How long lasting are the results?
So once you get through the treatment, and I said probably once a year or so, just like the other two, I can tell you from the CO2 laser, I do some touch-ups about once a year to kind of keep the skin looking nice and healthy. Same thing with this. So I would tell you it takes those 3 treatments about a month apart to get the skin kind of in the right setting, and then at about 6 months afterwards or so, depending upon the patient's liking, you can go ahead and have another touch-up. And that's just one treatment after that. It's not a series of 3 anymore. And when you do this, you're going to go back to your skincare regimen anyway. So, once you get done with this, and you can go back to your skincare regimen, the retin-A's and anything else, or vitamin C, whatever you're using on your skin, then you can go back to using that, and that'll also give you maintenance.
Are you having much discomfort?
Mm-mm.
You can see the whole process will take probably anywhere from 20 to 30 minutes. No numbing, so you don't have to show up any time earlier to dumb for 20 to 25 minutes.
Okay, I'm going to go ahead down your nose, okay?
Mm-hmm.
All right.
Well, as you can see, we finished the entire face and we put a cooling mask on Beth. So how do you feel?
It was pain-free. It was very easy. It was a great treatment.
How does it feel now with the cooling mask?
Great. Very cool.
So sometimes you might feel a little bit of warmth afterwards, but this with the cooling mask, everything feels a whole lot better, and she can be ready to go basically to do what she was wanting to do the rest of the day. I would tell you probably not to work out for a day or two, and you'd be ready to go. So if you have any questions or any other further interest in this, please let us know. Feel free to call the office or check it out on our website. Thank you again for joining us on this episode, and we'll see you next time.